Hi patients, friends. Our commitment here, as you can see, is to your health, as well as the health of your family. We're protecting you, our staff, and your fellow patients. While your care programs have been disrupted, we aim to serve as best as we can while ensuring adherence to all rules and regulations surrounding the COVID-19 epidemic that's going around our community right now. We could stay closed. Federal government, provincial governments would help us out, as a small business, but that doesn't serve you, our patients. We care about you, and you are why we are trying to stay open right now. If you look behind me, you can see some of the measures that we've taken. This right here is a way that we've completely quarantined the front desk from all traffic outside. If you look behind me, you can see the reception room. We have done our best to socially distance people that are coming in. We also have a hand washing station right here, and you can see that will be mandatory for anybody that's coming in as a patient. Now, we have had a crushing number of patients call us, text us, email us, needing care, in desperate need of care. We have decided, obviously, as I stated earlier, that we are going to open. We're going to open as best as we can with the focus of, first thing is patient safety. Second thing would be my staff safety. And then the third thing is your fellow patient safety as well. So to address these issues, we have decided that it's best if there's absolutely no interaction between our staff. So Dr. Angel and myself will not be in contact with each other at all. The front desk staff will be on completely separate shifts with zero interaction outside of the office. This way, it ensures absolute quarantine between ourselves. After each shift, we will be sanitizing and sterilizing the entire office. And there will be some downtime between where we can get out of the office before anybody else comes into the office. The doctors, Dr. Angel and I, will be responsible for cleaning the reception area as well as our office, and that's to a very, very high standard. And our staff, the CAs, Nadia and Christy, will be cleaning the reception area after each use, so again, not to contaminate each other. So I'm gonna bring you on a small little tour. You can see right behind me, again, the quarantined areas. We are going to have a dedicated time in the day for doctors, nurses, and care aides, who are the frontline people on this epidemic right now, where they can come in and they can get priority. We, as chiropractors, this is not our area of specialty. However, what we can do is we can serve them so they can help us get better faster as a community. We want to have them come in at a time that's separate from our regular patients. They are at higher risk, and I can't have my patients exposed to those more high-risk people. We're going to open on a limited schedule, starting with 3 hours in the morning, 3 hours in the evening, rather than our full 12-hour schedule 5 days a week, and that is just to meet the demands of these more critical patients that need care, need to get in and follow their programs. I know that people over 80, even if you're healthy, you might feel like you need to come in. I'm asking you, please don't come in. You are at higher risk. I understand that we do have a lot of patients that do feel they need that care. They need to get adjusted. They need certain things taken care of. I'm going to ask you, please don't come in. Parents with kids, we understand as well that we're all in trouble here. There's no daycare, there's no schools. You're gonna bring kids in, and we highly, highly encourage that. You know how much we love kids in the office here. Just please make sure your kids are responsible. We do have patients that are more high risk. Just before you come in, ask them to be respectful of other patients. Socially distance, 6 feet, 2 meters away from anybody in the reception room. That's not just for you, that's for everybody. Okay, we're doing this for other people. What else? Okay, so I'm gonna follow you, and so doctors are gonna bring patients in here. No, women aren't gonna be in gowns. Men aren't gonna be taking their shirts off like normal. What we're gonna be doing is we're going to, streamline this process as much as we possibly can. Any symptoms, patients coming in with any symptoms whatsoever, even if it is quote unquote the normal flu or just a cough, I ask you again, please stay away. There's so many different variations of how people are presenting with COVID-19. I cannot take any chances, again, for my other patients, for our staff, for myself. Please stay away. When you show up for your appointments, please be on time. This is to minimize contact in the reception room with you and other patients. If you are early, please just wait on the street, give or take 2 meters from anybody before you come in. Again, this is for your safety. Our goal is to minimize contact with you in the outside environment. We do have that mandatory hand sanitizing. As soon as you come into the office, please sanitize your hands right away. I gotta keep my staff away from any contact with even credit cards and hard surfaces. All right, so if you follow me, we're gonna walk through feeder room number 1, and then we're gonna walk through this area here. You can see this has been quarantined off behind me, right there from the reception room. This is gonna be the patient flow. So rather than patients going back out through the front door, we're gonna ask that they follow me right back through this way, come out the side door here, and down this hall, and out the side door this way. That way we can minimize contact between patients. We're supposed to be socially isolating right now, and that's the best way that I figure that we can do that. Anyways, that's it for now. Keep posted. I love you all. We're all gonna try and get through this together. Do our best to take care of you while keeping your health and safety in mind. Okay? Thank you very much.